welcome to Kavita Medicos Education. This is part second of diabetes mellitus. So here in part second, we are going to start with the sign and symptoms of diabetes. So there are three main symptoms of diabetes, that is known as classical triad, or three main symptoms of diabetes, or we can say that these are some 3 Ps of diabetes. So these are three classical or three main symptoms of diabetes which are known as 3 Ps. So first P we have polyuria. Poly means a lot, urea means urination. So here patients suffer from frequent urination problem. He will pass the urine frequently. Why patient is passing the pee frequently? Because when the high level of blood will get filtered from the kidney, then kidney will not able to absorb a lot of glucose from the blood, and this glucose will move into our urine. So for dissolving this glucose, we need a lot of water. So the water will come into the kidney, and this glucose will get dissolved into the kidney, into the water, and so patient will have a frequent urination problem here due to the process of osmotic diuresis, because for dissolving the glucose we need a lot of water. Okay, that's why he will have a frequent urination problem, or he will pass the pee frequently, and mostly he will pass the urine in the night. That is known as nocturnia condition. So next symptom we have polydipsia. As patient is passing the pee frequently, or he is passing the urine frequently, due to which he will have a severe dehydration condition in his body. So to compensate from this dehydration condition, he will drink a lot of water. He will feel thirsty. So patient have a excessive thirst condition here. Next we have polyphagia. It means eating a lot of food, as proper amount of glucose is not entering into the body, and our body cell and tissue will not able to produce the energy. So what our brain will think? He will think that there is a lack of glucose, and due to the lack of glucose, he will have a hunger stimulation in the body. In this way, a diabetic patient will eat a lot of food. He will have a excessive hungerness. Okay, so he will eat a lot of food, that is known as polyphagia condition. So these three are the main 3 Ps or main 3 symptoms of diabetes. Now, this high level of glucose which is flowing into our blood, and this blood is flowing into our whole body, so diabetes will have a effect into our whole body. Okay, so in generally, what symptoms we see in diabetes? What are the general symptoms of diabetes? First, patient can have fatigue and weakness condition due to the lack of energy, as glucose is not entering into the cell and no ATP or no energy is formed into the body. So patient will always have a fatigueness, he will always have weakness, and he will always have tiredness condition. Next, here patient have a weight loss condition. Mostly in type 1 diabetes, patients suffer from weight loss condition, because as I have told you that in type 1 diabetes, there is no insulin production. Insulin production is zero. Okay, so there is no insulin production. So when there is no insulin production, then no energy will form into our body, due to which our body will start breaking down the fat and proteins into our body. Okay, our body will do lipolysis and proteolysis condition. That is, it means breaking of fat and proteins into the body, that is known as fat and protein breakdown. Due to the loss or due to the wastage of muscles, patient will go in a weight loss condition. So weight loss condition can be only seen in type 1 diabetes. Next, we have irritability, mood changes. So patient will have a frequent mood swings. He will have mood changes problem. He will suffer from irritable condition, as there is a fluctuation in the glucose and sugar level in the blood. And this fluctuation will lead into a condition that is known as irritability and mood changes. Now, diabetes can also have symptoms into our skin, and it can also do infection into our skin also. So what are the symptoms which we will see in the patient? First, we have loss of skin turgor. It means due to the dehydration into the body, he will have a low moisture content into his body. So patient will have a dull skin. He will have a warm and dry skin due to the dehydration condition. Next, we have dry mucus. So patient have a dry mucus problem. He will suffer from pruritus. So what is pruritus? There is a dry skin, so he will have a itching condition. Okay, so patient will go through skin infection or he will have pruritus condition, or that is known as itching condition due to the dry skin. Next, we have skin and urinary tract infection. So mostly the female will have UTI. Why any female is having UTI when she is having diabetes? Because the blood which have high level of glucose and sugar, they also help in the germination of microorganisms. As we all know the anatomy of urethra. So urethra is present just below the uh, just below the urine. Okay, so when we'll pass the urine, then this high glucose and sugar will also come into the urine, due to which the microorganism or fungus will germinate into the urethra. Next, we have fungal infection. So patient will have fungus infection due to the high level of sugar or bacteria into the high level of sugar into the blood, and this sugar will support the bacterial growth. When patient will have a high level of sugar content into his blood, then this sugar is a very good supporter for the bacterial germination. So we can also have fungal infection into the groin area and into the armpit area. Next, we have delayed wound healing. So mostly we have heard that in diabetes patient we have slow healing of any wound, because in diabetes our sensory nerves and our nervous system get damaged, due to which even a small cut and wound get converted into a big wound or into a big hurt. Okay, so he will have a delayed wound healing due to the less blood supply into that organ. Next, we have eye symptoms. So what are the problems that we will see in the eye of the patient? He will have blurred vision condition. He can also suffer from double vision condition. Next, let's talk about the nervous system. So what are the symptoms that we will see in the patient? First, patient can have tingling and numbness sensation, that is known as paresthesia condition of the hands and feet. He can have burning sensation in feet, that is known as neuropathy condition. And next, he can also go through confusion and dementia due to the lack of blood supply into the brain. As if our brain will not get proper supply of oxygen and nutrition, then slowly it will also damage the brain nerves. And patient can go through confusion and dementia condition. Dementia means there is a short memory loss condition. Next, we have gestational diabetes. So if any woman who is pregnant and she is suffering from diabetes, okay, then in initial phase she will have no symptoms of diabetes, but later on in pregnancy she can go through increased thirst and urination problem. Now, in type 1 diabetes, symptoms appear in a very sudden way. Okay, there is a sudden abrupt of any sign and symptoms. So type 1 diabetes show the sign and symptoms abruptly, or there is a sudden onset of sign and symptoms. First, he can have rapid weight loss condition due to the breakdown of fat and proteins. And if patient will have a severe breakdown of fat and protein in his body, then he can also go through severe weakness condition. And in type 1 diabetes, due to the accumulation of ketones into the body, the blood will get acidic. And he can also go through diabetic ketoacidosis condition, in which patient can have various symptoms like vomiting, he can have abdominal pain, he can have fruity breath and odor from his mouth, and he can have deep breathing problem. So what is deep breathing? That is known as Kushmal respiration. Kushmal respiration means when we are gasping for the oxygen, that is known as Kushmal respiration. Now, in type 2 diabetes, the symptoms appear very slowly. So here in type 2 diabetes, patient will have a slow onset of diabetic symptoms. Initially, patient will have no symptoms. He will remain in an asymptomatic condition. That is why type 2 diabetes is known as silent killer diabetes. And later on in his life, he will have fatigue, he will have mild infection, and next he can have blurred vision. So what will happen if diabetes is uncontrolled and if we will not treat diabetes in a proper time? So if diabetes remains in uncontrolled way, then patient can have severe and late symptoms of diabetes. First, we have cardiovascular damages, as this high blood is also moving into our heart blood vessels. Okay, so when high level of glucose and sugar will move into the blood vessels, then this high level of glucose will kill. Then this high level of glucose can accumulate into the small blood vessels of the heart also, and patient can go through some cardiovascular diseases. For example, he can have myocardial infarction, that is heart attack. He can have atherosclerosis condition, or he can have stroke or hypertension condition. So he can go through cardiovascular disease. Next, he can also suffer from diabetic retinopathy. So retinopathy means when there is a damage of retina of our eye, that is known as retinopathy. In this condition, patient will have a complete blindness or he will lose his vision. That is known as vision loss condition. So why patient is suffering from retinopathy? Because in diabetic condition, when the high level of glucose rich blood will reach into the nerves of our eyes, then this glucose which is in our blood, it will absorb the water content from the cell and tissue. Okay, and it will damage the retina of the eye also due to the high sugar content. And in this way, patient will go into a condition that is known as diabetic retinopathy. Next, he can have a foot ulcer, as the sensory nerves, our sensation or our nerves get damaged in the diabetic condition. So even a small wound or cut is not healed in a proper time. And slowly what will happen, this small wound and cut will converted into a large wound. That condition is known as foot ulcer. And how we will treat the foot ulcer? We will cut that area which have foot ulcer. That is known as amputation of any area. So if we are removing any part of the body by cutting, that process is known as amputation. So to treat the patient from the foot ulcer, what the doctors or surgeons will do, they will do the amputation. Next, we have kidney damage. High level of sugar is getting into our kidney also. When kidney will not able to filter the high level of sugar, then slowly this sugar will damage the nephrons or nephrotic cell of our kidney, and they will damage the kidney here. So patient can go through kidney damage, that is known as nephropathy. So these severe and late symptoms will appear only if we are not treating the diabetes in a proper time, or if diabetes remain uncontrolled. So next we have diagnosis of diabetes mellitus. How we will diagnose the diabetes mellitus in the patient? So first we have clinical suspicion or symptoms. So doctor will suspect the diabetes in patient if patient shows the 3 classical triad of diabetes. Like if patient have polyuria, means frequent urination, or if he have polydipsia, it means excessive thirst, and polyphagia and unintentional weight loss condition, and more skin infection, then he can have diabetes. But this clinical suspicion is not alone. Okay, some laboratory tests are also done with the clinical sign and symptoms, then the diabetes is confirmed. Next test, we have fasting blood sugar. It means in fasting stage we are doing the blood sugar. So in this condition, a blood sample is taken from the patient, in which patient have not eaten anything for at least 8 to 10 hours. Mostly we will collect the morning sample in the patient before the breakfast. Okay, so it's a 8 hours of fasting, and then we are collecting the blood sample. In blood we will check for the glucose level. If the normal range is below 100 mg per dl, it means he is normal person or he does not have any diabetes. If patient is in pre-diabetic stage, then his blood sugar level will be in between 100 to 125 mg per dl. Pre-diabetic is a stage which is more than normal. Okay, it can be controlled. Okay, The patient can come into a normal stage if this pre-diabetic stage is controlled in a proper time, or if patient takes proper treatment of diabetes, then his diabetes can be controlled. Okay, so it's a in-between stage of normal and diabetes. Next, if patient blood sugar level is more than 126 mg per dl or equals to 126 mg per dl, it means patient is having a diabetes. Next test we do, that is known as HbA1c test. So it's a glycated hemoglobin test. Okay, in this test we will take the blood sample of the patient and we will check for the average blood sugar level of patient from past 3 to 4 months. Okay, so what is happening here? In blood we have glucose. Okay, and in RBC we have a protein that is known as hemoglobin. So if more glucose and sugar will be present into our blood, then this glucose or sugar will form a bond with the hemoglobin protein which is present in RBCs. Okay, so this hemoglobin protein will form a bond with the glucose. That is why it is known as glycated hemoglobin. So it will give the average blood sugar level of patient of past 3 and 4 months, or we can say that it will give the average blood sugar level for 128 days, for 128 days, which is the lifespan of one RBC. So normal range we have less than 5.7%. In pre-diabetic stage we have 5.7 to 6.4%. And if patient is suffering from diabetes, then this range will come equals to 6.5 or more than 6.5%. Next test we do, that is known as random blood sugar. Name is suggesting random. It means at any time of the day we can do this test. Either the patient have taken the meal or he have not taken any meal. Randomly we are checking the blood sugar of the patient. That is why it is known as random blood sugar. It is done at any time of the day. So if the ranges are equals to 200 mg per dl or more than 200 mg per dl with the sign and symptoms of diabetes, okay, if ranges are in between 200 mg per dl or if it is more than 200 mg per dl and patient is also showing the sign and symptoms of diabetes like 3 classical triad of diabetes like polyuria, polydipsia, polyphagia, it means he have diabetes. And all these tests are done twice. Okay, all these tests are done twice for its proper confirmation. Next test we have oral glucose tolerance test. It means how our body is handling the glucose. So mainly this OGGT test. Okay, we can also write OGT test. Okay, so OGTT test is done mainly in the clinical settings. So what we do in this test? We give 75 gram of glucose. Okay, 75 gram of glucose is dissolved in a water and patient will drink that water. So after 2 hours, we will check the blood sample. It means what we are checking in this test? We are checking that after drinking 75 gram of glucose, how his body is handling the glucose. Okay, we are checking for how his body is handling the glucose. So after giving 75 gram of glucose, a blood sample is measured and to see how quickly that person returns into a normal level. Okay, so mainly this test is done in pregnancy. Okay, if any pregnant woman, she is suffering from diabetes, she have gestational diabetes, then we will do oral glucose tolerance test. The normal range is below 140 mg per dl. Pre-diabetic stage we have 140 to 199 mg per dl, and in diabetic we will have more than 200 mg or equals to 200 mg per dl. Next we have postprandial. Post means after, prandial means eating. So after taking the meal, after taking the food, we are checking the blood sugar. So postprandial blood sugar, that is known as PPBS, means after taking the meal or after taking the food, we are checking the blood sugar of patient after 2 hours. Okay, after, suppose I have my breakfast in 9 a.m. Then I will check my blood sugar at 11 a.m. Okay, after 2 hours, we are checking the blood sugar in the patient. So blood glucose level measured after a meal, usually after 2 hours. Okay, after starting the food at 9 a.m., I will check my blood sugar at 11 a.m. So if my normal range is below 140, we have normal range that is below 140, Pre-diabetic, we have 140 to 199 mg per dl. And in diabetic stage, suppose if anyone is suffering from diabetes, then his range will be more than 200 mg per dl or equals to 200 mg per dl. Next test, we have urine examination. So basically, we all know that in diabetic condition, patient have glucose and sugar in his urine. Okay, so we will check the glucose in the urine of patient. So how we will check the glucose in urine of patient? By doing the Benedict test. So how we will do the Benedict test? We will take the Benedict reagent in a test tube and we will add 8 to 10 drops of urine in a test tube. Then heat the test tube for 3 to 4 minutes. Okay, then allow the test tube to cool. When the test tube will get cool, it will change its color. Okay, if color is in green or blue, it means patient is having no diabetes. If this color get changed into orange or in dark red form, then the patient is suffering from diabetes. This is Benedict test, which we will do for glucose. Okay, next, glucose can also be confirmed in the urine by doing the dipstick test. So it's a quick and modern technique in which we will take a strip, a chemical strip, and we will dip that chemical strip in a urine sample for 1 to 2 seconds. Okay, then remove the strip from the urine and check the urine color with the suitable colors which are given in the that box. Okay, so we will confirm the strip color with the suitable colors which are given in the dipstick box. Okay, next test we will do, that is ketone test. So we all know that when our body breaks the fat instead of glucose, then ketones will present into our urine. So in ketones, we will do the Rothra test. So what is Rothra test? In this test, we will take the 5 ml of urine sample in a test tube. Then we will add the crystals of ammonium sulfate in a test tube. Then slowly add some sodium nitroprusside into the test tube. Okay. Then again add ammonia into it and heat the solution. If there is a purple ring formation in between the test tube, it means patient is having a diabetes. Okay. If purple ring will appear in between the test tube, it means patient is having diabetes. Again, ketone can be tested with the dipstick also. Okay, we are dipping the chemical strip in a urine sample and then we are confirming the color changes in the urine. Next test by glucometer. So it's a self-monitored glucose test in which a small portable device we have, and we will prick our finger and we will take the blood sample into the glucometer. So this glucometer will give the reading within 1 or 2 seconds. So it's a self-monitored glucose self-monitored glucose test. Okay. So these were some diagnoses for diabetes.